GERD, or gastroesophageal reflux disease, is a chronic digestive condition where stomach acid or, occasionally, bile irritates the lining of the esophagus. It is a more severe and long-lasting form of acid reflux, which occurs when stomach acid backs up into the esophagus. If untreated, GERD can lead to serious health complications. The symptoms of GERD can vary, but common ones include heartburn, which is a burning sensation in the chest, often after eating, and may worsen at night or when lying down. Regurgitation is another symptom, characterized by a sour or bitter taste in the mouth, or the feeling of food or liquid coming back into the throat. Chest pain can also occur, which can mimic the symptoms of a heart attack, leading to confusion or concern. It's important to distinguish between the two. Difficulty swallowing, known as dysphagia, is another symptom, where there is a sensation that food is stuck in the chest or throat. A chronic cough, often worse at night or when lying down, laryngitis, which presents as hoarseness or a sore throat, asthma-like symptoms such as wheezing, coughing, or shortness of breath, especially in those with existing asthma, and nausea can also occur in some cases. Several factors contribute to GERD, including a weak lower esophageal sphincter, or LES, which is a ring of muscle at the bottom of the esophagus that prevents stomach contents from flowing back into the esophagus. When the LES is weak or relaxes inappropriately, acid reflux occurs. A hiatal hernia, where part of the stomach pushes through the diaphragm into the chest cavity, can weaken the LES and increase the likelihood of acid reflux. Obesity is another contributing factor, as excess weight, especially abdominal fat, can put pressure on the stomach, forcing acid back into the esophagus. Pregnancy can also contribute to GERD due to hormonal changes and the physical pressure of the growing uterus. Delayed stomach emptying, known as gastroparesis, can increase reflux symptoms as well. Certain foods and beverages, such as fatty foods, chocolate, spicy foods, caffeine, alcohol, citrus, and mint, can relax the LES and trigger reflux. Smoking weakens the LES and impairs the natural repair of the esophagus, while certain medications, like NSAIDs, blood pressure medications, and sedatives, can also contribute to GERD. A healthcare provider may diagnose GERD based on symptoms, medical history, and possibly additional tests. In many cases, GERD can be diagnosed based on the symptoms alone through a physical examination. An endoscopy may be performed, or a flexible tube with a camera is inserted through the throat to look at the esophagus and stomach for signs of damage, such as inflammation or ulcers. pH monitoring may involve inserting a small device into the esophagus to measure acid levels over a 24-hour period. Esophageal manometry is a test that measures the movement and pressure of the esophagus, often to check for issues with the LES. In some cases, a barium swallow X-ray may be conducted, where a patient drinks a barium solution to highlight the esophagus and stomach in X-ray images. Treatment generally involves lifestyle changes, medications, and in some cases, surgery. Lifestyle changes may include diet modification to avoid foods and drinks that trigger symptoms, eating smaller meals, avoiding lying down after eating, elevating the head of the bed, losing weight if overweight or obese, quitting smoking, and avoiding tight clothing. Medications may include antacids, which are over-the-counter medications that neutralize stomach acid, H2 blockers that reduce acid production, proton pump inhibitors that block acid production and help heal the esophagus, and prokinetic agents that help the stomach empty more quickly. Surgical or procedural treatments may involve fundoplication, where the top of the stomach is wrapped around the lower esophagus to strengthen the LES, the LANX device, which is a magnetic device placed around the LES to prevent acid reflux, or endoscopic treatments to improve the function of the LES. While it may not be possible to completely prevent GERD, you can reduce your risk by maintaining a healthy weight, avoiding trigger foods and drinks, eating smaller, more frequent meals, quitting smoking, elevating the head of your bed, avoiding tight clothing, and managing stress. GERD is a manageable condition with lifestyle changes and appropriate treatment, but if left untreated, it can lead to more serious complications like esophageal ulcers, bleeding, or Barrett's esophagus, which may increase the risk of esophageal cancer. If you're experiencing symptoms of GERD, it's important to consult with a healthcare provider for proper diagnosis and treatment.